screen to speak about technological evolution in Bibliosalut, in the Virtual Health Sciences Library of the Balearic Islands. Okay. This is the index of my presentation: introduction, technological evolution, change in librarians' roles, and conclusions. Okay, where is the Balearic?
Here we are. Better go.
Yeah. Let's see. We are working here in the Balearic Island, in a region of Spain, with a population about 1,100,000 people. And in Spain has 17 regions. And every Spanish region has a project of digital health library, but in different states of evolution, in very different states of evolution. This is the structure of the Balearic public health system. We have 3 health areas. Mallorca, the biggest island. Do you know Mallorca? Menorca, and Ibiza, Formentera. We have 7 hospitals and 56 primary care centers with more or less 10,000 health professionals. This is our potential users. Okay, our mission is to facilitate the most important scientific information to the public health professionals of the Balearic Islands by using the new information and communication technologies. And I have underlined using the new information and communication technologies. It's very, very essential in a digital library, the technology, the communications technology. Okay, this is a little the history of Bibliosalut from 2003 to now, with the main milestones, with remote access, with the web, etc. And this is the team, the Bibliosalut team. We have a small team with 5 librarians, 2 administrative staff, and external collaborators for topics like training, quality, medical English, etc. And IT expert too. The IT department is a collaborator with us. Okay, about technological evolution. Digital library. Digital library is digital resources, but not only digital resources. It's very important, the digital services. The technologies are always present in a digital library, and it's necessary for this reason. It's necessary updated and innovative professionals is essential. No? We need to work with information technology experts, and to talk with the IT experts, it's necessary to know the possibilities of the technology. Okay, here are some examples of technologies in our digital library. The first one is the website and the content management. We have a web with the different access to the resources, to electronic journals, databases, ebooks, and access to the services. Okay, and at the same time, is a blog, the blog of the library in the same website. This is the for the website. We use a content management system and CMS like Drupal, WordPress, etc. We use Joomla, and it's necessary, I think, to know the possibilities of CMS. It's necessary to know the components, extensions, modules, etc. for the possibilities. No? This is an example of the use of the website. This is a new project with subject portals. This is the same home, but for primary care users, with underlying different journals and different resources. Okay, another very important technology in the digital library is the remote access. This is an essential technology in the digital library. In the picture, you have a little the evolution of the health library from traditional library, print format, to inside access in the hospital, in the centers, and to outside access. And the new step is the mobile access. The mobile access is our challenge for us. I refer to with different devices like smartphones or the new tablets. Do you know the smartphones and the combination with the tablets? Okay. Anytime, any place, anywhere. 40 years ago, an Italian company, it's incredible, but it's true, was thinking about remote access in the digital libraries. But Martini has another slogan, another good slogan: no Martini, no party. I agree, but I say I prefer no remote access, no digital libraries. This is a job. It's only for underline the importance of the remote access. This is our system of remote access, open access by the British company Bibliosalut. With this system, it's possible to create a consortium for several centers with general resources for all users and specific resources for one or more center, for one or more hospital or users group, like nurses and neurologists, etc. Okay, with in the system of the remote access system of Bibliosalut is Open Access LA. And with this system with LDAP connection, the authentication is with the same keys used to access the intranet. It's not necessary another kind of keys. Another technological tool is the A to Z list and link resolver. This is an example of the access to the journals. And with the link resolver from a register, for example, from PubMed database, it's possible access to the full text. With in our case, it is link source by EBSCO, the link resolver, and it's possible with the same keys of the intranet and with the same keys and any time, any place, anywhere, access to the full text. Okay? This is the admin interface to A to Z, and it's very important to know the possibilities of this interface, no? Mainly the custom links. Okay, another technological tool in the digital library, in our digital library, is a system, a management system for the document supply service. The objectives of this system are to democratize the access to documents, to centralize and automate the document supply service for all the health professionals in our region. This is the interface, the admin interface of our application. We use Bibliosalut by Kronosdoc, a Spanish company. And this is an example and a screen of the petition, the manager of the petition with connection with Spanish collective catalogs. It's very, very simple for the user to request a document. This is another example with the LibreSolver. It's possible to request very, very easy with the same keys, anytime, any place, anywhere. And the form, the different data are automatically. And this is an example of the procedure of the document supply service. For us, the quality is very, very important, and in all the services we have different procedures. Okay, another service with another technology associated is the Ask a Librarian. When a user types a question, the system can suggest a possible answer, because this is in relation with the frequently asked question. And for this service, we use the application HESC. This is an example of the administration system with different categories, like document supply service, like general information, etc. And it's possible to use set answers to reply to the question. This is very useful for us. Okay, another very, very, very important technology in our digital library is the different technologies for the dissemination. It's imperative to have a good and fast communication channel with users. I am thinking in social networks, in RSS feed, for example, in a newsletter. We are working now in the design of a system to send newsletter. And for example, it's important to disseminate information about scientific production of our researchers. We have a hashtag, Bibliosalut IB, for this task. And in conclusion, for the dissemination, a good service with a good publicity is nothing. Okay, very, very important. Okay, another technology is Google Docs. We use Google Docs for our statistical system. We use for statistics about resources, about services, about web portal, users, and economical evolution. A good service without publicity of the results is nowhere. This is very, very important for us. Okay, another technology is Bibliosalut, a new health information portal. It's a new channel of Bibliosalut to disseminate information or our institution. It's a current curation project in reality. It's an instrument to knowledge management. It's summarized in Bibliosalut.com. It's in project. This is a sample free screen of samples with different news, with different categories and subcategories about research, about another topics with videos, etc. Okay. Okay, and I have more examples, but these examples are in project. No? Institutional repository is in project, e-learning, newsletters, bibliometric study, a study of possible selection of a discovery is in project, and mobile access for smartphones and tablets. Okay, and the change of the in librarians' roles for the technology is clear. No? We need knowledge. Is true, no? But general and personal skills are basic necessities in a virtual environment. For a digital library, it's necessary capacity to adapt to the new times is essential. The innovation, the capacity to work with multidisciplinary teams is essential. Enthusiastic, the creative, analytical, adaptable. We need super librarians. Okay. And in conclusion, every technological profile, but is essential, and we need to improve our generic and personal skills. And the last one, to be continued. Grazie mille. Thank you very much.